Lower cross syndrome and pelvic floor dysfunction is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. This video has to do with lower cross syndrome. You might have heard of terminology upper cross syndrome that has to do with this area. But since pelvic floor is down here, we're going to talk about lower cross syndrome. Lower cross syndrome refers to the dysfunction that happens between certain muscles in this region. So when I say dysfunction, let me clarify some things. Anytime and every time you move, there are the main players of that move. They're the main doers of the move. They have buddies that support that move. And in order for that to happen, those are called agonists and synergists. And then you have antagonists. Antagonists are muscles that do the opposite. So in order for you to have a nice supportive structure in a neutral position, you need to have a well balance between the agonist and synergist and antagonist and their synergist. With lower cross syndrome, this does not happen. So in a healthy situation, your lower ab and your glutes and lower back work together, but in their functions are opposite. So when they work together equally, you're in a neutral position. In a lower cross syndrome, you have a weakness of your lower ab and weakness of your glutes. Then you have tightness of your psoas and tightness of lower back. So when that happens, you know you're out of sync, you're dysfunctional. Now, with that dysfunction, pelvic floor dysfunction is part of the presentation there. With pelvic floor dysfunction, a lot of different symptoms can happen. It can be incontinence, it can be erectile dysfunction, it can be painful intercourse, it can be pain in your lower ab, pain in the head, not the lower ab, pain in the lower back, pain in the hips, pain in the sacroiliac joints, and poor posture in general. Look at it like a bag, the bottom of which is what most people think pelvic floor is, but your pelvic floor is the floor and the walls. So the bag walls include the walls of your pelvis and the sides of your body, the front and back. And the bottom is the bottom of the bag. You cannot have a healthy, intact bottom without addressing the surrounding, the bodies of that bag. With lower cross syndrome, those are things that we are presented with patients, and through examination and gait assessment and postural assessment, we can very quickly see what's going on. That's why it's so important. If you have any pelvic floor issues, regardless of what the symptoms are, you pay attention to your posture and make sure you see a pelvic floor therapist, either a physical therapist, a chiropractor, a nurse, whoever is doing pelvic floor in your state. Make sure that they have a very clear understanding and assessment procedures to rule out and rule in postural contribution to your pelvic floor. This is important. It's not really happening as much as it should, or at all for that matter, and that is why we are not having 100% recovery rate. Granted, there is no guarantee, but you're minimizing or maximizing the chances of effective treatment. If you have any questions, make sure you use one of the methods of contact in the description box, and make sure that you subscribe to my channel. Until next time, take care.